healthcare, being a medically trained person, and also business, entrepreneurship and innovation. And the reason I joined Amref Health Africa is to see how, for me, it's interesting to see how innovation and entrepreneurship can come into an area that is a human right, that's supposed to be provided by government but needs to be sustainable, that's supposed to be provided by development agencies like Amref but needs to be sustainable. So I come into Amref Health Africa to see how we can introduce innovation and entrepreneurship models to provision of healthcare and to build community health systems, to improve advocacy, so that we can actually have sustainable solutions to the challenges of healthcare. If you look at the way the world is moving now, it's becoming more and more idea and technology driven. That's really what is driving the world. That is why so many people have mobile phones. That's why so many people do their business on their mobile phones. And you will see from a McKinsey report that was done, I think, last year, that 80% of the world's health problems can be solved through the mobile phone. Meaning that you can actually provide knowledge, you can provide information, you can provide consultation, you can provide health training through a simple gadget like the mobile phone. This is just an example. So for me, I'm looking at Amref, a very successful organization over the last 60 years, and looking at its next 60 years and what will be different for the next 60 years. It's done extremely well. Amref Health Africa has huge capacity of people, huge capacity of knowledge, huge intellectual assets that we need now to look at the next 60 years. How do we transform this to now provide lasting solutions, for our communities? So for me, and even to speak to our donors, is to say that we are looking at donors now as not only donors, but as partners, as stakeholders in what we are doing, and say, instead of just sitting or implementing the projects through the funds that are given to us by the donors, how can we work with our donors to transform, rather than just to change for a certain time, to actually transform the way people look at healthcare in Africa, to look at different solutions for providing clean water. Instead of just building a borehole, how can you do the borehole and then provide the people a way of sustaining the borehole through technology, through a mobile phone app that is able to go and request for 2 liters of water, and you get your 2 liters at an affordable rate and you go back home, which means that tomorrow the borehole will still be there and the water will still be there and will still be clean. So these are the solutions that now Amref Health Africa needs to look at. Even the development agencies that fund our activities are also looking to shift this way from aid to trade. We are Africa's biggest healthcare development agency. We have to lead the way for the world in terms of moving the development agencies from aid to trade for Africa. So that's the role that Amref Health Africa is going to play, and that is the role that our teams of highly experienced people have to transition to, from just providing services to providing solutions. Yeah. Donors have their own objectives, and for us as an implementing organization, we meet the community objectives and the donor objective. As we transition, we'll also be looking at providing the donors more value in terms of, you want to go to a donor, you get money, and then next year you want to get money to do something different, because already what you started has developed its own legs, has become sustainable and is moving on, so that you're not using money to do the same thing over and over and over again. And therefore, even for the donor, they're looking at investing in new ventures all the time. And I find Amref Health Africa to be the only really African development agency that is positioned for this. Because we are African, we are looking for African solutions for African problems, and not just because we are African, but because we are positioned for it. We have the skill, we have the technology, and we have the people to do it. And for our donors is to say that whatever dollar you put, the dollar you put next year will be going to develop a new project, because the first dollar has already started generating sustainability. So that's the way I would put it, and that's the way I see it, and we are positioned for it. work with, the key thing for them is to build systems and structures that support their health policies. And for us, it will be to identify needs together with the government. And say, for example, if you look at the Millennium Development Goals and now the Sustainable Development Goals that are coming up, it is about looking at the problem and then you look at a sustainable solution. Yeah. So if you look at maternal health or you look at child health, there are many things that need to be done. You need to provide safe delivery, for example. Now, safe delivery can be provided by sending multitudes of midwives or doctors to help the mothers, or creating structures within the communities that support the midwifery program, so that you're not having to transport people to help mothers and take them back. We do outreach programs. How can we use these outreach programs to develop local capacity so that long after we are gone, the government can look back and say, this is existing because of the partnership we had with Amref Health Africa, and it exists beyond our flying in and flying out. So these are the benefits the government expect to see. And because of this, we expect that the government to work with us more closely, because we want to work with them not only as people who manage donor funds, but people who are going to work with them to develop a solution. And therefore, we want to be engaged right from the beginning in the question. When the question is being formulated, that's where we want to be involved. So that then, as the question is being formulated, we look at what we have, what we are able to do, look at what the governments want, and then we pull the three together to form a solution jointly. We don't want to go to a government and say, by the way, we think we need this. We want to develop the question together and all the way to the solution.